Bismillahirrahmanirrahim. Quote of the day. All it needs for a dream to come true is someone to believe in it. I am Dr. Alishba Rasool, PGR Community Medicine, and today I will be presenting influenza under the kind supervision of Professor Dr. Staira Afzal. Learning outlines, introduction, burden of disease, epidemiological determinants, prevention and treatment, recent advances, MCQs. Learning outcome. At the end of the presentation, participants should be able to describe influenza, its epidemiological determinants, its prevention and treatment. They should also be answered, they should also be able to answer all the MCQ questions at the end. Introduction. Influenza, commonly known as the flu, is an infectious disease caused by influenza viruses. Symptoms range from mild to severe and often include fever, runny nose, sore throat, muscle pain, headache, cough, and fatigue. Burden of disease. It is truly an international disease. Worldwide, the annual epidemics are estimated in about 4 to 5 million cases of severe illness, 3 lakh to 5 lakh deaths, spread with travelers worldwide. Annual global incidence of influenza infection up to 30% of all children, up to 10% of all adults. Flu pandemics. Spanish flu pandemic, 50 million deaths. Then in 1968, Hong Kong pandemic, 1 billion deaths. Then COVID-19 pandemic in 2019. Types of the influenza virus. There are 4 types of the seasonal influenza viruses, types A, B, C, and D. Influenza A and B viruses circulate and cause seasonal epidemics of disease. Influenza A viruses are further classified into subtypes according to the combinations of the heme agglutinin and the neuraminidase, the proteins on the surface of the virus. Currently circulating in humans are the subtype AH1N1, AH3N2 influenza virus. The AH1N1 is also written as AH1N1 PDM09 as it caused the pandemic in 2009 and subsequently replaced the seasonal flu AH1N1 virus, which had circulated prior to 2009. Only influenza type A viruses are known to have caused pandemic. Influenza B viruses are not classified into subtypes but can be broken down into lineages. Currently circulating influenza type B viruses belong to either B or B Victorian lineage. Influenza C virus is detected less frequently and usually causes mild infection, thus does not present public health importance. Influenza D viruses primarily affect cattle and are not known to infect or cause illness in people. Epidemiological determinants. Agent factors RNA envelope orthomyxoviridae 0.8 to 0.19 micron in diameter, 3 subtypes A, B, C. Structure of the influenza virion, hemagglutinin, neuraminidase. Host factor, age, it affects all ages, sex, both genders equally affected, immunity, subtype specific. Antibodies against HA and NA are important. Chain of transmission, reservoir, animals and birds, source of infection, cases subclinical, periods of infectivity, nasopharynx from 1 to 2 days before and 1 to 2 days after the onset of symptoms. Mode of transmission, droplet nuclei, droplet infection, respiratory tract. Respiratory disease, abrupt onset of symptoms, fever, chills, muscle aches and pains, sweating, dry cough, nasal congestion, sore throat, headache, malaise, and fatigue. Complications, primary influenza viral pneumonia, secondary bacterial pneumonia, CROP, myositis, myocarditis, toxic shock syndrome, and dry syndrome. Levels of prevention. Primary prevention. Remember the 3 W's to protect yourself and the others this season. Wash your hand, wear your mask, watch your distance, get your flu shot. Second is the specific protection immunization. Influenza flu vaccines, often called the flu shots, are vaccines that protect against the four influenza viruses. Most flu vaccines are flu shots given with a needle, usually in the arm, but there's also a nasal spray flu vaccine. The CDC recommends annual influenza vaccinations for everyone aged 6 months or older. Vaccination is especially important for people at high risk of influenza complications. Inactivated subunit, intramuscular or intradermal live attenuated vaccine, intranasal. The trivalent vaccine contains the three inactivated viruses, type A, type A, H3N2, and type B. The quadrivalent influenza vaccines, introduced for the 2013-2014 season, contains the same antigens as the trivalent vaccines, with the exception that quadrivalent vaccines contain two types B strains. Vaccine viruses are grown in chicken eggs, and the final product contains the residual egg protein. The vaccine is available in both pediatric and adult formulations. Age group, dosage, and number of doses. 6 to 35 months dosage 0.25 ml. Age group for 3 to 8 years 0.5 ml, and then over 9 years 0.5 ml. Reasons for getting a yearly flu vaccine. The first reason is that because flu viruses are constantly changing, flu vaccines may be updated from one season to the next to protect against the most recent and most commonly circulating viruses. September and October are generally good times to get vaccinated. Vaccination in July and August is usually not recommended for most adults, but can be considered for some groups. While ideally it is recommended to get vaccinated by the end of the October, it is important to know that vaccination after October can still provide protection during the peak of flu season. The second reason that annual vaccination is recommended is that a person's immune protection from vaccination declines over time, and annual vaccination is needed for optimal protection. Contraindications of vaccination: severe allergy to chicken eggs, severe reaction to previous vaccination, develop GBS within 6 weeks after getting vaccination, children less than 6 months of age. Signs and symptoms of influenza can vary by age, immune status, and presence of underlying medication conditions. Uncomplicated influenza can have signs and symptoms: fever, muscle aches, headache, lack of energy, dry cough, sore throat, nasal congestion, and possibly runny nose. A number of tests are available to detect the flu viruses and the respiratory symptoms. The most common are called rapid influenza diagnostic tests, work by detecting the parts of the virus that stimulate an immune response. These tests can provide results within approximately 10 to 15 minutes, but may not be as accurate as our flu tests. Therefore, you should still have flu even though your rapid test is negative. Other flu tests called rapid molecular assays detect genetic material of the flu virus. Rapid molecular assays produce results in 15 to 20 minutes and are more accurate than the rapid influenza diagnostic tests. Usually, person will need nothing more than rest and plenty of fluids to treat the flu. But if you have a severe infection or at high risk of complication, doctor may present an antiviral drug to treat the flu. The antiviral drugs can help treat flu illness. Antiviral drugs are different from antibiotics. Flu antiviruses are prescription medicines, pills, liquids, intravenous solutions, or an inhaled powder, and are not available over the counter. Antiviral drugs can make illness milder and shorter over the time of the sickness. Now it's time for the latest updates. Understanding the barriers and attitudes towards influenza vaccine uptake in the adult general population, a rapid review. Influenza is common respiratory infection associated with the substantial clinical, humanistic, and economic burden globally. Vaccines are essential to prevent and control influenza and are recommended by the public health agencies, such as the WHO and US CDC. However, vaccination rates vary considerably across the globe. This review aimed to investigate the perceived barriers and attitudes to influenza vaccination in the global population in order to identify strategies that may improve the influenza vaccination coverage. A structured literature search was undertaken to identify the studies that reported on the patient-reported attitudes towards the influenza vaccination focused on the adult general population in 16 pre-specified countries. 80 studies were included in this review. Negative attitude towards healthcare was found to be the most agreed upon barrier to vaccine uptake. The most agreed promoter of influenza vaccination was trust in healthcare services. Approximately 50% of the participants intended to receive the influenza vaccine in the following season. To improve the influenza vaccination coverage, healthcare workers must strengthen the foundation of substantial trust in healthcare services and provide educational materials that improve the influenza vaccination knowledge among the adult general population. Obesity as a risk factor for severe influenza infection in children and adolescents, a systematic review and meta-analysis. Obesity has been recently identified as a predisposing factor for a worse prognosis in virus illnesses such as SARS-CoV-2. However, its role in children with influenza is not yet clarified. The current systematic review and meta-analysis aims to assess whether obesity is a risk factor for either hospitalization or a worse prognosis when hospitalized among children infected by influenza. We systematically searched the following databases using a structured algorithm. Medline, Clinical Trials, Government, Cochrane, Central Register of Control Trials. Statistical meta-analysis was performed using the meta package in our software. Included studies were evaluated using the Newcastle-Ottawa scale. Among children with influenza, obesity increased the odds of hospitalization with a pooled OR of 1.89. When hospitalized, children with obesity were also more likely to have a worse outcome than their healthy weight counterparts with a pooled OR of 1.24. In an effort to lower the heterogeneity, a leave one out meta-analysis was conducted. Publication bias was assessed with the visual inspection of funnel plots and the trim and fill method. Certainly, assessment was evaluated using the grades. The findings of our meta-analysis suggested that obesity in children with influenza is associated with a worse prognosis, both hospitalization and ICU admissions and death. Now it's time for the MCQ session. Influenza is a serious global health threat that impacts all countries every year. Which of the following influenza virus stereotype that causes most of the epidemics? A, type A. B, type B. C, type C. D, type D. Or is it E, type E?
Type A.
Yes, it's the right answer. Influenza is a viral infection that attacks the respiratory system. Which of the following is not the common symptom of flu caused by the influenza virus in the adult? A, fever. B, cough. C, rashes. D, headache. E, sore throat.
Rashes. C.
Yes, it's the correct answer. In which year did the influenza pandemic was the most severe pandemic in history which killed millions of people? It is caused by H1N1 virus with the genes of avian origin. A, 1945, B, 1900, C, 1928, 1918, or 1998.
It's A.
It's D, 1918. H5N1 is a highly pathogenic and contagious causative agent of the H5N1 flu. Which of the following is the source of H5N1 infection in humans? A, birds. B, pigs. C, ferrets. D, cattle. E, dogs. It's A, birds. Immunity to a disease is achieved when there are antibodies to that disease in a person's system. Which of the following virus can give lifelong immunity to the disease after prior infection or immunization? A, influenza A virus. B, influenza B. C, influenza C. D, measles. Or is it E, influenza D virus?
B.
It's D, measles virus. The most common route of transmission of the influenza virus is airborne droplets. Which of the following type of virus is considered highly contagious and is known to spread rapidly from person to person? A, influenza A. B, rhinovirus. C, influenza B. D, HIV. Or is it E, herpes?
A.
Yes, A is the correct answer. Which of the following statement reflects the pathogenesis of influenza virus? A. Viremia is common. B. Pneumonia is not associated with secondary bacterial infection. C. The virus enters the host in airborne droplets. D. Viral infection does not kill cells in respiratory tract. E. The virus frequently establishes persistent infections in the lung.
B.
It's C. The virus enters the host in airborne droplets. Influenza virus is spread when people with flu, cough, sneeze, or talk and sending droplets with virus into air. Which of the following statement is not correct about the preventive measures of the influenza virus? A. Washing hands more often helps. A sick person with flu should stay isolated at least for 24 hours. Over-the-counter antiviral drugs are available for the influenza virus. Live attenuated and inactivated viruses both are used for vaccination. E. Detect flu virus by respiratory specimen. It's C. Over-the-counter antiviral drugs are available for the influenza virus. A 16-year-old girl came to the clinic with a sore throat, fever, and headache. The symptoms resembled seasonal influenza flu. Which of the following primary sample specimens is collected for the laboratory diagnosis of the influenza virus? A. Blood. B. Sputum. C. Urine. Nasopharyngeal washing. Or is it E. Stool?
B. Oh, D.
Yes, it's D. Nasopharyngeal washing. What is the best time of the year for a person to be vaccinated against influenza? Vaccination by the end of the October, in summer before the next peak flu season. C. Flu symptoms developed. D. Anytime it makes no difference. E. Vaccination in July and August.
B.
It's A. Vaccination by the end of October. This is the key of the MCQs. Thank you, everyone. There's a link given to our YouTube channel. Kindly like, share, and subscribe. Thank you.
Thank you very much, Dr. Alishba.
Allah Hafiz.
Khuda Hafiz.